Good evening to all. Once again, welcome you all. And just Mr. Paul, Dr. Paul has messaged me that there was some kind of emergency and he had to go. Now he is connecting with us. I am Sunita Kumari, the founder of Taksh and psychologist. Thank you so much for being with me here and just let him connect with us. I hope he will connect with us soon. Thank you so much joining with me here, and thank you so much, Mr. There is a name with the Samsung and the Burma Sachin, and thank you so much, Ashish ji, Nishu ji, and Ravindra ji. Thank you so much, Varnika ji, Mr. Paul. Mr. Paul, I am waiting for you here only. You are in inbox. Let me try again. So maybe he has some kind of issue, network issue. We must try again and again. Never give up. And we will definitely connect. I hope this time he will connect with us. Just trying again and again. Yeah, finally. He is connected. Thank you so
Sorry.
much. Thank you so much for connecting with us, and you are most welcome here. And thank you so much for giving your time, most precious time, Dr. Paul. And yes, I would like to inform here everyone that we got late just 2 3 minutes because of Dr. Paul has got some emergency call and he had to go there. So that's why we were having some connecting issues. But right now he's back. So thank you so much, Dr. Paul. Thank you so much.
It's my pleasure to join you. Privilege is
Thank you.
all yours. Yeah.
Yeah, thank you so much. So these days we are having so much issues, right, which is related with the COVID and some kind of misguiding informations and myths are there. So the first of all, I want to know that why COVID is so severe these days. Last year we also faced, but this year is too severe in our country. Why it's happening?
Yeah. This COVID is so dangerous because, COVID is actually a uninvited guest to our bloodstream. So it's like a surprise to our immune system when
Right.
when it is encountered for the first time into the mental. So it acts like a master of deception. Deception in the sense it will fool your immune system or body. Say for example, when we have a infectivity with someone, or when we have enough viral load in your respiratory tract or inside your nose, inside your oral cavity or something, our immune system couldn't able to identify that this virus, who is an uninvited guest, is already there in our body. The virus will try to fool your immune system. That's why it is called as master of deception. So since it is not familiar to our human body, and our immune systems falsely says that it is not pathogenic to our body, it will continuously retain in our body for a certain period of time, so that our body starts showing some signs and symptoms. That is the time we seek medical attention, or we go for an antigen test, or we go for RT-PCR or whatever. So by the time the viral load inside our body may be too high, So it might, as everyone knows, it firstly affect our respiratory system.
Right.
So then it may spread to other parts of the systems too. So that is the reason why it is so dangerous, and also it is like a hit and run killer. Meaning to say, it will invade your body and do some changes. Or there are two types of changes. There are irreversible changes and there are irreversible changes. So when the stage is like irreversible, we cannot come back to the normal, even if it is with medical support or even if it is with ventilator support or whatever. If the irreversible damage has been happened, it is very unlikely to come back to the normal stage. That is the reason why this virus is so deadly and so dangerous.
Okay. So for whom it could be more dangerous, like if someone has some kind of disease or for whom who are already fit and fine. So then just please.
As like any other disease, of course, it's the elderly people who are most vulnerable, because their immune system will be not so developed, or they might be deteriorating, or they must be having some comorbid factors, like they must be having diabetes, they must be having hypertension, they might be having dyslipidemia, or they must be having asthma, or people who are having cardiac illness. All those people are vulnerable to these COVID patients, because since COVID is like, it's just a flu. Initially, when it arrived first time in Wuhan, people thought it's just a flu, same like any other respiratory infection. So they thought that we can treat the virus by treating the same how we treat pneumonia. So the pneumonias are usually treated by IV antibiotics and nebulizations or hospital administration or whatever. But in some cases, with these comorbid factors, this immune-related things, those vulnerable people might go to irreversible damages, which we can't treat appropriately.
Okay. So what would be the first step if someone finds himself or herself positive, COVID positive? What would be the first step?
The first step is obviously the self quarantine, because everyone knows that, because we are still studying about the virus. Quarantine from the family members and the immediate person is the first step. Then we should inform the health authorities. We should call the toll-free number in the respiratory states, and we should inform that we have so and so symptoms. The point is, how will we know that we have a COVID infection? The only possible way to find COVID infectivity is antigen testing and this RT-PCR. But the thing is, even if we have the symptoms like COVID symptoms like fever or sore throat or loss of smell sensation or taste sensation, that time itself we should understand and we should act as if we have COVID, and we have to refrain from everyone. And we are supposed to test the antigen when it is at the peak level, meaning to say when the viral load is at its peak. Immediately after showing the symptoms, say for example, for day one I had cough or fever, and next day if I go to the laboratory for antigen test, it might show us negative.
Yes.
So what we are supposed to do is we have to wait for 5 or 7 days. We have to be quarantined for those days. And on the 5th or 6th day, we should go for this testing. Or else what is happening is our test is shown as negative and we think that we don't have COVID infection. We go around, mingle with people, and the diseases will spread eventually. So if we have the symptoms, no matter what the result is, we have to be quarantined in
Right.
this scenario.
Okay. So in what condition we must visit hospital? Right. These days the beds are not available and people are just rushing here and there. So actually, when we need to go or visit hospital.
Usually, this is a controversial question. Actually, during the last year, I got many calls from developed countries like UK, US, and they are saying that they are tested COVID positive, but they are not hospitalized. So they thought that it is the problem of health department there. It is the problem of the local government there. So they actually blamed government for that. But the reality is we don't need to be admitted for simple COVID symptoms. Mean to say we are dividing COVID positive patients into three categories: category A, category B, and category C. Category A are those patients who are having less symptoms, like they have fever, they must be having sore throat, but mild symptoms, mild cough, all those things, without any comorbid factors, like they don't must not have any DM, they must not have asthma, they must not have any cardiovascular diseases, they are young, so they are under low risk categories. So they will be grouped under category A. Those people, they can be treated at home. We need to monitor their BP, their pulse, their oxygen saturation, and every 24 to 48 hours we can reassess their status. Category B are those patients who are COVID positive and also at the same time they have other risk factors, like they have diabetes, they have hypertension, they have dyslipidemia. So those patients, and they are, in addition to the category A symptoms, they must be having these diseases, and also the symptoms which is already present in category A is persisting. Same, for example, the fever, 101 degrees Celsius or 103 degrees Celsius. That fever is persisting even after giving paracetamol, or even after giving oxygen or nebulization, their this one breathing complaint is not coming down. So in those categories, they need to be admitted in the hospital. And for category C, these are highly risk people. So for them, hospitalization is mandatorily needed. In addition to that, we need to add life-saving drugs for those patients.
And
So,
yes,
whom to be admitted? For your question, we need a doctor. The patient should be evaluated by a doctor, and the doctor should assess the category or the severity of the illness of the patient, and it should be the doctor who should decide whether he should be admitted or. There are a lot of people, they are sending me WhatsApp like they are tested COVID positive. Then what should I do? So in that case, we have to assess the patient clinically, and we have to find out which category they belongs to, and based on that, they needs admission.
okay, that's great. That's great because people were not aware about there are three categories, A, B, and C. So they just rush to hospital. Everyone is just rushing to hospital, and they're just looking for the oxygen, whether it need is there or not. They are just worried a lot. So who is actually in need of oxygen? Actually, I don't think so. Everyone needs oxygen, right? So only few category may need, like B category and C category will need oxygen level. We need to check out and we need to provide them. So is there any kind of category who actually needs oxygen?
That is also again based on the clinical findings, and those people who are having less oxygen level in their body, those people are maybe required for oxygen, or sometimes even after giving the oxygen, their breathlessness won't subside. So we need to give additional non-invasive ventilation support or even ventilator.
Okay.
So it
Uh,
depends upon the clinical status of the patient.
it depends on their severity, what they are facing.
Yes,
Okay.
yes, yes.
So if a
Not
person
all
gets
COVID positive patients need oxygen.
okay, so if someone gets positive with COVID, what the person must do for recovery so that the person can recover fast?
I'm sorry, I didn't get you.
What are the steps if someone gets positive? Then what are the steps and what are the precautions the person can do for himself or herself to recover fast?
Okay, so once he or she is positive
Yeah,
or before.
after positive.
Uh, So once he or she is positive, irrespective of the category, they have to be quarantined, even if it is in the home or even if it is in the hospital. So if it is under category A, they can be treated in the home, as I told you earlier. So they have to be on drugs, like they have to be on paracetamol if they have fever, they have to be on antibiotics, they have to take vitamins, all those things. We have protocols given by ICMR, and also we can repeat the testing after a week or after 10 days. Even after getting a negative result, we still have to be quarantined for another 1 week to make sure that we don't have the infectivity, but we are not a carrier. That maybe our immune system has developed that so that we can resist the infection, but it may not be same if we have a elder people in our home. So still we can carry a disease. So we need to be quarantined even after we get a negative result.
Okay, that's good. So, and what kind of food they must prefer?
Any kind of food. There is no any restriction unless, say for example, if the patient is diabetic, he should avoid foods which are rich in sweet. Or if he or she is hypertensive, he should avoid salty foods. And there is no food restrictions, I guess. Any light foods they can take. There is no anything which boosts their immunity or anything which can recover the fast. They can take it. There is no restrictions.
Okay. So
They can
these
take
days,
plenty of oral fluids as well.
okay, okay. So these days, people are just avoiding mask. Even they know what the severity is going on, but still they just avoid mask. And even they don't know what kind of mask they must wear. So just give some kind of information about this. I think there is a network issue again.
Clarify more because everyone knows about everything. The thing is how we use the mask matters. It doesn't matter which type of mask you use, N95 or surgical or cloth. Anything can be used, but the thing is how we use. You see that most of the people here, they are using mask to save themselves from penalty from the police,
Right,
or
right.
because that is not an ideal practice. There is also something called double masking that our government has implemented recently. That is like we used to wear a N95 mask, and over that we are wearing a cloth mask. So if you are wearing a surgical mask or N95 mask, still there are gaps over here or here. So there is a possibility that our air droplets or our infection can still spread to others even if we are wearing a mask. For some people, even if you are wearing a mask, there are possibility that there is gaps over here or over here. So the government suggests them to wear a double mask, a cloth mask above the N95 or surgical mask. And surprisingly, I see a fellow who has wear both the surgical mask and also the cloth mask. But the thing is, he has wore his surgical mask over here like this, and the cloth mask over here like this. And the part should be covered is here, our nostrils and our oral cavity. Only except that part, everything is covered. So the purpose is not served. So this is what matters. It doesn't actually matters which kind of mask we are using. What matters most is how we use the mask. And also, if you are a medical student, he or she must know wearing a mask is a procedure for them. It must take around 30 to 1 hour to demonstrate how to wear a surgical mask. Meaning to say, we are only supposed to touch the twine of the mask. We are not allowed to touch the inner part of the mask because we think that the outside part of the mask is contaminated. Because when I'm talking to you, my droplet from my mouth is forcefully expelled into your face, and it is prevented by when you wear a mask. So it is assumed that the outside part of the mask is contaminated and it has some bacteria or virus. So most of the time people do wear a mask like this, and what they do, they will do it like this. Or sometimes if it is like this, they will do like this. So this part is contaminated, and see, this part is contaminated, and our hand is also contaminated. And
Right.
what we are going to do with this hand, we are going to do this, we are going to touch others. So likewise, we are also spreading the disease. So it really doesn't matter which kind of mask we are using. What matters is how we use the mask, and if it is a cloth mask, we should wash it every day. If it is a surgical mask or a N95 mask, we have to dispose it on time. Those things are has to be kept in mind strictly, and not for this one escaping from penalty sake. We are wearing the mask means the purpose won't be served.
We are not taking it seriously for our towards our health. Actually, we are just afraid of penalty. So we need
Yes,
to
yes,
take it very seriously. Really.
yes, sir. Yeah, yes,
Yeah.
yes, yes, yes.
Yes, yes.
Yes.
So there are some kind of myths also about vaccination. People are just afraid of. People are just avoiding to just now. People are getting just vaccinated, but still, few people are like this. They are afraid of. It's not
Mhm.
good for them. It's unhealthy. It's not safe, and so many kind of rumors are there. So, is it correct or not? Vaccination is good or not?
See, this is actually a disappointing question because the thing is, before giving to the public, this vaccine has been experimented on several healthcare workers, and they are brave enough to be a part of the experiment. And after trying it on most of the doctors and most of the nurses, paramedics, hospital people, that after it has shown his efficacy, that is the time we are giving this to public personals. And still, people are having doubt of having vaccines. Means it is really a disappointing thing. There are a lot of myths and there are a lot of facts, and one of them is like. They are thinking that this vaccine has been developed in a short period of time without proper these things. So they think that it is unsafe. But I don't think that because this for every vaccine to be established in the market, this there are some steps actually for a drug to be marketed in the public place. There are some steps. So we need 5 years of trials. There are different stages for that. First they try it on animals, then they try it on unhealthy people, healthy people, then they try it on healthy people. Like that, there are staged processes for a drug to be marketed. So this thing, I don't think that this vaccine has the scientists have been skipped any of this test.
So, I think there is network issue again. Am I audible to you?
Yeah, yes, I can hear you.
Yeah, yeah. Okay. So, it's still we talk about the rural area and the urban areas. Urban areas is still getting facilities and oxygen and everything they are getting. But if we talk about the rural areas, like you are right now in rural area, you are just located in rural areas. So what are the difficulties they face, and what are the facilities and how they can cure themselves in this current situation as all the facilities are not available there. So what would you
But
guide?
okay, for me, actually, rural areas are more safe than urban areas because they are not thickly populated like town or urban
Yeah.
areas. And if they have symptoms of COVID and if they simply quarantine themselves by staying at their home, that itself will act as a cure for them because it is not so thickly populated. Mild diseases we can manage in our home itself, but we need to monitor. And if the category is changing from category A to category B, that is the time they need hospitalization. But I don't think because even if they are in the urban area, the protocols won't change. Even if it is in the rural area, the treatments are still the same. So I don't think that it really matters. What matters is the severity. If they have those comorbid factors, then they are under risk.
So basically, they are more safe from the urban areas because they
That
have
is
the
what I think.
natural environment.
I could be wrong, but this is what I think compared to the
I
population criteria.
I can believe in this too because when we talk people who are just staying in the rural areas, they're just some of my friends. They're just saying everyone is just fit and fine. Everyone are just enjoying their life as they were enjoying earlier because everything is normal there, and they are not afraid of that. So because the environment they are getting, that's very pure. That's not polluted a lot, and the other eating style, the lifestyle is totally different from urban areas. So yes, they are more. I can say
Yes,
that
they
they
are
are
more
more safe.
safe. I wanted to add that I surprisingly I have seen some of the people who are in under quarantine and they are staying in some flats. And what they are doing, they are most literate people here. Okay, and what they are doing is like they are sitting inside their flat, closing all the windows, doors, and all. They are thinking that there must be some COVID patients in the nearby flats, so they are closing all the windows and closing all the doors and sitting inside a closed chamber. Compared to the this one, rural people, they have diverse amount of oxygen. They are living in a less thickly populated area, and they are more immune than the urban people.
So yeah, is it okay to use AC if someone get positive with COVID? Is it okay to using AC on regular basis? Because I have yes, please.
Yeah, using AC is not recommended. ICMR advise not to use AC in the COVID scenario
Okay, okay. So
because
first,
usage of AC increase the moisture, and this virus is sustained in the atmosphere as air droplet. So if any factor which increases the moisture content of the environment may worsen the spreading capacity of the virus. So that is the reason why AC should be avoided.
you have given a beautiful information for our people, and we are here just to inform that what are the myths and what is the reality. If someone want to ask any question, they can ask here. And before they ask, I want to ask one question: that what are the things they can, if someone get positive, so what the things they can do to get motivated, to have some kind of emotions or positivity that yes, they will recover soon. Because when they get fear, when they see and when they hear that I am positive, so somewhere they are just losing their hope, and I think it's affecting a lot mentally. And so what would you say in what they should do to get positive?
Okay, for answering this, I got two scenarios. I will tell you two scenarios.
Yeah,
This is actually real scenarios. Oh, sorry.
it's okay.
First one is about one of my friend who is COVID positive and he is home quarantine. And second one is COVID positive and he is under category B and he's admitted in the hospital. First fellow, he's a IT professional. He's an engineer and he's COVID positive and is quarantined in the home. And he called me. See, staying inside a home alone in a quarantine atmosphere itself is boring, and our minds get disturbed. Our emotions, we might go for depression and all. So this guy called me and told me about his illness and all those things. I promoted him to diversify his thoughts from the illness and what would you say? I wanted him to engage in some activities like doing yoga or doing some breathing exercises, which gives marked difference in the next day. And the next fellow who is admitted in the hospital, he is also away from his family members. He is admitted in the hospital because he has some cardiac diseases in the presence of COVID. And suddenly he's having the feeling that he's going to die, he's going to deteriorate, and he called me from a patient's phone, and he called me and panically asking me that, sir, I'm going to die, my saturation is falling, I don't know what is going to happen. I said, don't worry. I called the staff nurse there, and when I asked them, everything is fine. It's just his emotion that he's going to fall. He's like that. I said, don't worry. I will be there in few minutes. When I gone there and visited him and personally examined him, he got too much relief. So the positivity of our mind or the emotions also matters to the any kind of illness, not only COVID, any kind of illness. COVID is really affecting our respiratory system. So when we do breathing exercises or anything which makes our mind positive, will give a faster recovery from the disease. That is what.
Again, network issue. Yeah. So, yeah, there was some kind of a network issue. There is a one question from Vijay Kumarji, and he's asking, what is a black fungus? Yes, I have
Uh,
also studied about this. So, just please give some kind of brief information about this.
Black fungus is actually not a new infection. Black fungus is, in layman terms, we call black fungus, but in medically we say mucormycosis. It is basically a fungal infection. It is not a new one. It can come to anyone who is immunocompromised or immunocompromised in the sense those people's immunity level is too low, or people who are having other diseases which affects the immunity of the person, like HIV or any immune disorders. All those people are prone to get a fungal infection. Unfortunately, this mucormycosis also happens to COVID patients who are having low immunity power with other comorbid factors, not for all COVID positive patients.
Okay, so no need to worry about that a lot because it's coming on news that actually the these days when you get up early in the morning, at what time you are getting up is the negative news only there. When you go, whatever the time is, when you just watch the news, you just go to the social media, everywhere just is we are talking about the COVID, and we are not talking about how people are getting recovered soon, and there are lots of people who are recovering soon, and we are worried about more the COVID and negative things. So thoughts are also becomes very much negative. I would like to ask you, we are normal people. We are just stay away from the hospital and the situations. But you are frontline. You are the soldier for right now for the country. So when you see every time, the whole day you are seeing patients, what the feelings you have and what kind of emotions do you deal with that?
Uh, I don't know what to say. The thing is, I can see normal people. I can also see sick people who are COVID positive. COVID positive people are same like us also, because they are normally speaking, they are doing all the things. They are one among us. We cannot say there is one COVID positive patient besides us. The scenario is going like that. For them it's fine, but the thing is, for those people who are having other comorbid factors, who needs ventilator support and who needs this intensive medical management, for them it is pathetic and heartwarming, because they are staying in the hospital, their family members are away, we are the one who is calling the bystanders, meaning to say their relatives, and we are the one who is giving information to them. So if the patient is dying, the family members is not with them. We are the people who is next to them, and everyone is trying their best. I don't think no one can be harsh to any of the COVID positive patients, because they really can feel the pain of getting away from the family members, and also at the same time they are infected. So there are so many emotions happening at the back. We are not, that is not exposed. Yeah.
Have you ever felt like that if you will get, I hope and I wish you won't get affected with the COVID, but still sometimes it comes in your mind that if I would get affected with this, what will happen and some kind of things. Actually, I want to know that, I want to just highlight people that what the situation you are facing, right? All the doctors and nurses are going through these days. You are not able to meet with your family, your cousins, whatever that you can't spend time with your friends, and you don't have the special your own time, right? Like just like I have two of my friends who is doctor and working day and night, and they are working a lot, and they don't have time even to eat, even for having their own food. So, what the feeling you feel that? Have you ever thought that if I would get affected with this, how will I deal with that?
Yeah, because every time we are at risk. Because the thing is, if a patient is presented with a breathing difficulty or a fever or something, some patients we can manage with oxygen or other routine medications. But for some patients, we need active management. Say, for example, we need to intubate the patient, or we need to say we need to oral cavity, wherein we can see lots of viral this COVID nuclei. So, irrespective of the condition of the patients, when we are actively managing a patients, we are more exposed, and that is part of our job. We can't do anything because we all are primary contacts by somehow or anyhow. So that is expected anytime. Well, fortunately, I have never been positive for a while.
That's great. That's great. Actually, this the willpower is you have that it's amazing, and you are doing amazing work. And right now we have one more question. After COVID hit, victims they get some problems. Why?
Okay, this is what we call post-COVID syndromes. Meaning to say, after the infectivity with COVID, we are getting some kind of syndrome. Say, for example, if we are having a wound in our body, and once it is healed, the scar remains, isn't it? COVID is also the same. COVID is giving wounds to our body. Say, for example, our respiratory tract is infected, our lung parenchyma is infected, our alveoli is infected. So once it is healed by the proper medications or by our own antibodies, or because of the vaccines which we are getting, or whatever, the scars may remain. So when unfavorable situations comes again, say for example, for asthma patients, when they have an asthmatic attack, this predisposing factors may shoot up, or when they have a cardiac disease, they still have the same thing. So for those vulnerable peoples, even myocardial infarction, we have seen so many patients who had an MI or myocardial infarction or cardiac arrest after MI, after this COVID. So these are part of the system which we are expecting also. We can't
So,
do anything.
what are the basic steps we can do to cure ourselves from COVID? What are the basic steps we can follow in daily routine?
Okay, as we all are by heart by this time. SMS. SMS is social distancing, masking, sanitization. This is the three things which we must do, because this virus, as I told you in the initial part of the conversation, this is actually a uninvited guest to our body. So this virus is always giving a shock to our immune system. When it is there in our body thinks that it is a familiar one. Actually, the virus is fooling our immune system. So the thing is that there are lots of viral load in our nasal cavity, in our oral cavity, but our immune system thinks that it is part of the system. That is the problem with this virus, and that is the reason why it is so dangerous. So the only thing which we can do is to quarantine ourselves from others. After the infectivity time goes away, this virus subsides by its own, or by giving the medications, it might go. We
And
might get a immunity after the infection, but study says that the natural immunity which we get after infection may not last long. That is the need for a vaccination. So for the vaccination, when we get a booster dose, study says that we get proper infection and proper immunity against this virus. But
great.
still, even after vaccination, it doesn't guarantee that you may not affected with virus again, because this virus is brilliant again. This virus will mutate again itself. So if, suppose we are vaccinated for a particular virus, and what will virus do? They know that we are immune. So the virus will alter their body in such a way that we can defend. That is why we say that this COVID is more brilliant. So that is why the need for vaccination and use of mask again after vaccination, and quarantine if we have infectivity, all those things we have to follow.
That's really amazing, and that's beautiful information you have shared with us. The basic can do we can in daily routine that we can do some kind of meditation, some kind of daily routine basis exercises, or you even I would like to include here that we are running a 1 week free of cost just due to a COVID and to make awareness. If you anyone wants to join that, you can join the workshops is going on yoga, which is related to boosting your immunity. So if anyone wants to join, they can drop DM us, and definitely we join them. And the second thing is we need to follow our daily routine, right? So that we must have some kind of routine which we can follow it, and it won't pressurize or give a mental stress like as we are going a physical challenge, is facing a physical challenge, as well as we also facing a mental challenges more. So, in this situation, what would you suggest that how they can save themselves from a mental stress?
Yeah, from mental stress, doing yoga and doing breathing exercises, all those things is helpful for our body. Especially pranayama, breathing exercises, kapalabhati, all those things boost our breathing capacities. The problem with the COVID people is respiratory problems mainly. So what we need to focus is the breathing exercises. This one, we say the vital capacity of our body will increase when we do this pranayamas or kapalabhatis, all those things. And positioning our body also, like if we are lying down in a supine position, it is better if we lie down on prone position or left lying position, so that our lungs can expand to its maximum level. So that also matters, and we have to be positive in all the ways. We don't need to be panic, because we all are going through it. We still can survive this disease.
So I hope this beautiful information you all people have gained that, and we will follow that. And I would request here, as Dr. Paul has suggested, that just wear a double mask and just sanitize yourselves, do regular basis exercises, have a good healthy food, and just avoid junk food and have a healthy food. So thank you so
I'm sorry. I wanted to emphasize. I said double masking, but the way we wear the mask matters, not just the masking. Sorry.
yeah. Just pointed. Please noted that the wearing, how do you are making a mask and how you are wearing it. Just be careful about that. Not wearing is important. How the way you are wearing it, that is most important. So just
Exactly.
be
Excellent.
careful about that. Thank you so much, Dr. Paul. Thanks a lot for giving us this your precious time, and you have made it. And thanks a lot for giving us such a beautiful information. Thank you so much. And
Yeah, yeah.
thank you everyone who have joined us. And I hope you all have joined the knowledge. And one more question is there, is it possible to take right now, Dr. Paul? Is it possible for you to take it right now? There is a
I'm
one
sorry.
question. There is a one more question. If you have
Oh,
time,
sure.
then we can.
Sure, sure, sure,
Many
sure.
people take steaming if even they get cold. Is there any harm or to take steaming often? Okay, they are asking is steaming. How long it's good? We should take it on regular basis or on alternate days, and how must we do it?
No, steaming can be done. There is no contraindications. We can do thrice a day or 5 times a day. It's okay. It is good for us. We can do steam inhalation. That is good.
On the regular basis, we can do it. It's
Yes,
healthy.
yes, yes, yes.
Yes. One more question is here. Will the vaccine cause allergy? Is there any kind of allergy?
That question, I need to be more vigilant, because the thing is, anything can be allergic, because allergy is a thing which is specific to person, because the thing which is allergy to me may not be allergy for you. So, say for example, uh, uh, there is say for example, you are allergic to dust, and I am not allergic to dust. Okay, and I went to some forest or something, and in my dress there are a lot of dust. Okay, and since I am not allergic to dust, I don't have any problem. I don't exhibit any symptoms. But when I'm near to you, and if accidentally you are exposed to the dust which is placed on my shirt, your body will respond,
Okay.
isn't it? So it depends upon person. The allergy is specific. That is the reason why I said allergy is specific to persons. So the factor which is causing allergy to one person may not be causing to another person. A vaccine can causes allergy, but it depends.
It's
But
very person
again,
to person. It's very
it
person
varies
to
per
person.
person. Yes, exactly, exactly. But again, it is also there are a lot of myths also in the this one conception of this administration of this vaccine. Many people say that women will become infertile when they are vaccinated. That is totally a myth, because there is no study saying that women are going infertile. And also there is one myth saying that they are saying that if we are vaccinated, and if we are tested for COVID antigen, our body test will say it is positive. That is also not true, because vaccine is not a live virus. It is a deactivated virus or virus particles which is injected to our body, and because of that deactivated virus, our immune system could able to sense the virus load in the future. So when we are exposed to the same virus again in the future, our immune system says that this is the same virus which we are vaccinated. So we can defend ourselves. So this one we can say that the allergy thing. Some people might have fever for a day. Some people might have a headache or a pain at the injection site. It's a universal symptom for all vaccines.
I would
Nothing
like
major
to
common.
I would like to include some information here. Just like if I talk about my mother, she got vaccinated, and but she didn't have any kind of allergy or any kind of side effect. She is absolutely fine. Even she didn't get any kind of fever. Even she didn't get a 99%, 99 point of fever. She didn't get. But one of my friend, she is just 26 years old. She got 104 fever,
28.
140 fever. So it depends how the person is different, right? The capacity, the immune system. My mother is just 62, but she didn't get affected with that. But my friend is just 25 or 26, and she got affected. So it depends how people are more stronger with immunity or their body structure and the inner power what they have. Am I right, Dr.
Yes.
Paul?
Yes, yes, you are absolutely right. And we also had some kind of patients like in the last week, we got a patient who is negative for both antigen and RT-PCR. So if he is done this test outside, he might be thinking that he is not COVID positive. But we had suspicion of COVID positivity because of his clinical presentation, because the way he presented his illness and the CT chest, all suggested that he has COVID. So when we tested, it's all negative, but it doesn't mean that he is actually negative. He is already having the disease. For this, we need a proper evaluation and workup. So we cannot rely just based on the findings like a fever or a report. We really need to have a clinical examination before we conclude.
There is one more question. If mother gets COVID, is there any possibility to give feeding?
Feeding, yeah. For a mother who is having active COVID, we don't recommend to feed the baby, but she can feed once the infectivity, when she recover from the disease.
Okay, okay. So there is a one more question. Does it get very severe like a anaphylaxis reactions? There is a
Anaphylaxis.
kind, yeah.
I
There
think
is some kind of, yeah.
I
I
think
don't
she
know.
might
I
be
don't know
thinking
about
about,
such. Yeah, you are a medical
yeah,
field, so you must
yeah, she
know. I
might be
don't
thinking
know.
about anaphylactic reaction.
Okay. So is there
Uh,
any kind of severity, reactions?
uh, Possible, because I will tell you one example, because to clarify this, my mother, my own mother, she was admitted in the hospital last month for her total knee replacement. So when she was admitted, she was allergic to all the antibiotics, irrespective of any drugs which we give. She's allergic. I don't know if it is psychological, or I don't know. She may get swollen skin blisters or something like that. So whenever she has some infection, we never give her antibiotic. So when it comes to uh, hospitalization, that is the time we give test dose, and we have to prove that she doesn't have a infection. That is the time we give antibiotic. So my mother, she's anxious kind of category, and she's allergic to almost all the antibiotics, is supposed to take the vaccine. And I wanted to convince her, and she rightly say no, because she's already allergic to all the drugs. So how can she take the vaccine? And she recently had her surgery, but she's also under high risk, and she has to be vaccinated. But fortunately, when she has vaccinated, she never exhibited any kind of allergic reaction. Anaphylactic reaction, in the sense, the patient may go for unconsciousness, or some kind of urticaria in the skin, or some kind of cardiac abnormalities or something like that. Rarely it can happen, but minute, very rarely. But it depends upon persons or our sensitivity to different allergens. But it is not true for all the, out of 100, maybe 0.001 persons can go for this allergic reaction.
So the
But
answer is
it's not a medical.
person must get vaccinated, right?
Yes,
Whether
yes,
they have the
definitely,
allergy and
definitely.
they don't have, they must, each and everyone must get vaccinated. So as the priority basis and how they can get it or what the time slots they are getting. So everyone must go for a vaccination, and I hope all the myths have gone, and we have given all the answers, and I hope it's very helpful to everyone. And again, Dr. Paul, thank you so much for joining me here and to giving me so much information. Not only me, the people who are listening here, who are staying with us here, and who are looking for the real facts, because there are lots of information, and people don't know what they must believe. The differentiation is very difficult. So you have given the beautiful information, the real facts, and thank you so much for giving me and the people who are joining us. So everyone, thanks a lot to joining us and having just staying with us here. Have a great day. Have a just again and again, once again, I would say, I would request, just wear double mask in a right way. That is most
Yes,
important.
yes,
And get vaccinated. Do daily basis exercises and do whatever is possible for you. Breathing pattern. good food, and do something daily basis which is interest you and which makes you busy and it gives you happiness for your mental health, and make some kind of routine and follow that. Have a great day. Have a beautiful journey of life. Thank you so much. We will meet again soon. Thanks a lot. Thank you so much.
Yes. It's my privilege to join you. And also, one more thing I wanted to add that
Yeah.
until now we were blaming the government. So it is no more government's responsibility now. It is citizens' responsibility. So to refrain from the COVID risk, we have to do action, not the government. We cannot blame government all the time. So not only for us, for our future generations also, we have to. It is the citizen responsibility. I wanted to emphasize
Right,
that.
right, right. We can't blame every time the government has
Yes,
all the kind of
exactly.
responsibility. It's
Yes,
first
yes,
our responsibility. Just
yes. We
to
have to do
care
our
about
part also.
everything. Yeah, yeah. So first of all, we need to take our responsibility. Then we are completing that. Then after we can talk about the politicians what they are doing. First of all, just need to see yourself
Yes,
how
yes,
you
yes,
working.
yes,
So
yes,
it's a
yes, yes.
beautiful message. And would you like to say anything else, Dr.
I'm
Paul,
sorry. I'm sorry.
at the end? Do you want to give some kind of message at the end, or we should give now?
This one, just emphasizing this one that citizens' responsibility and the SMS thing. That is sanitization, masking, and social distancing. Please
That's
practice.
that's the thing. Okay. Thank you so much. And everyone just
Yes,
saying thanks to you, Dr. Paul. Everyone just
yes,
thanking you. Thank you, no. Thanks a lot. Bye bye.
yes.